Diana Sassy, and I'm with the Michigan Department of Health and Human Services, and it is a privilege to be here to talk about fair housing and environmental justice. So I'm excited to provide some context before we get into our panel discussion, and I really wanted to start with this photo right here because it's really personal to me. So this is my grandfather in the 1950s when he moved to Flint, Michigan. He resided in Mississippi and moved to Michigan so that he can help support the automobile industry. Prior to that, he was the first Sergeant General in the Airborne, and so he really felt like he'd be able to utilize that experience to really help support and build the northern states. As you can see, there's a sense of pride of here, really having a home, having home ownership, having a car, and really thinking about generational wealth and making sure that his future generations had a stable environment. That's really a prelude to redlining. So although we had Jim Crow laws in the South that really promoted segregation and were more deliberate, what we also had across the nation at the time is redlining, and that was more covert. So as you think about redlining, you think about, again, segregation based on race. And here's some of the discriminatory language that was equated with redlining, but it's basically a way to categorize neighborhoods based on the presence of Black and people of color. So if you look right here, it really kind of starts with the progression of what they felt like were areas that were more desirable, areas that you invest in. So essentially what they did was create disinvestment in slums and neighborhoods, which was the opposite of what my grandfather moved to Michigan for. This map gives you a visual aid of that. So you can see again, looking at the areas like blue and green that were considered desirable. Green was there were no people of color. Blue was sort of like a buffer area, so maybe you have one or two families. When you look at the other areas like yellow and red, that's where they really kind of pushed people of color together and allowed some of those people were lucky enough to have homes that they can purchase and be a homeowner. But predominantly because they devalued these areas, they built a generation of renters. They also disinvested in the water infrastructure and the development in those areas. So kind of, again, making the assumption that these people, as they would put it, would come in and create undesirable communities. They created undesirable communities. I want to give a shout out to the MSU Extension Office because, again, there's a lot of great information on their website, and I was able to utilize a map from there. I recommend that you guys take a look. There's not only Flint, Michigan, there's Detroit, Saginaw, and a number of other areas where you can take a deeper dive into the redlining and how it was impacted community to community. Now I want to talk about the intersection of redlining and environmental justice. So as I mentioned before, that disinvestment in those communities led to lower costs for factories to move in. So you have your factories in a neighborhood because you've devalued that property value. It's cheaper for them to come in and to dump. Think about the regulations at the time. So you have air quality, you have pollution in the soil, you have all of these contaminants that now you've made it easier for them to be in areas where you've labeled undesirable based on race. So that's where, again, this image really just kind of shows how we've created a community where we know that there's going to be huge environmental justices as it relates to, and redlining is just one of the elements that contributed to that. Next, I'd like to give a shout out to Regina Strong, who is our environmental justice public advocate. Her and her team put together the My EJ screening tool. And on this page, you can see some of the categories and indicators that allow you to really utilize this map so that you can take a closer look at your community and see, again, those historical things in terms of pollution sites, air quality, and otherwise. Here's just a visual aid from that tool that allows, again, it shows sort of a heat map feature where you can type in your zip code or county and really see what areas have that higher EJ score based on those categories on the previous slide. I'm really sharing a lot of resources here because I think it's our job to do our homework and know how our communities were impacted. So next I'm going to talk about something that I'm super passionate about, and that's social determinants of health. Because as you think about social determinants of health, sometimes we think about healthcare as being the primary indicator that relates to health outcomes. Well, it's not. It's not even close. And you can see right here with these percentages, there's a number of things that impact health outcomes. As we look at social and economic, that's 40%. So think about, again, that legacy of wanting to make sure that your family has what they need to be successful down the line. And a lot of that is attributed with home ownership, land ownership. Again, that trickles down to health outcomes to come. So I had a visual aid here, but I think that the really key takeaway is that, again, there are so many factors that contribute to health outcomes that go beyond just going to the doctor, and we have to be very conscious of that. Life expectancy. If you guys are familiar with the Robert Wood Johnson Foundation, they have a website here that, again, I'm going to tell you, take a look at it, because you can type in your zip code and it tells you, based on the characteristics of that area, what your average life expectancy is. And to me, it's mind-blowing. You know, even as we do it from county to county, it may not seem significant, but that's because it's county. If you really drill down to communities, sometimes there's like a 10 to 15-year gap based on where you live. But I really would like for you guys to take a look at this website, plug in your zip code, compare it to others. And then I have here, just thinking about where I am now in Ingham County, I wanted a comparison to where I was born in Genesee County. So I plugged in those areas. And again, you may see, oh, 3 years or so, that's not really significant, but we're looking at county. We're not looking at city, we're not looking at community. And even with that, 3 years is 3 years. So again, I just want to kind of leave with this as we think about how all of this is interconnected as it relates to health outcomes, environmental justice, and so forth. And I'm so excited to be joined by Brianna and Linda here as we dive into this a little deeper.
That is so interesting, and I took a little bit of time the other day to look at the website in regards to the zip codes, right? And I was like, where can I move? Because I really want to live my best life. I don't know about you. I'm not trying to move to New England right now, where it's like life expectancy there I think is 80, where here it's 76, I think was the average. So that was really interesting. Thank you for sharing that. I encourage all of you guys to go to that website and see how your communities fare you with your age. But I would like to have this fireside chat with Nina and Linda and Brianna. And one of the questions we've already answered, which is the zip codes and how it affects your life expectancy. But what are the current fair housing issues that are impacting other areas in society? And do you still see a systemic or systematic unfairness in housing practices today? And if so, can you tell us how, from your perspective, it has impacted us?
They're looking at me, so I will take that first question. Good afternoon, everyone, or good morning. Thank you for the opportunity to speak with you today. Nina, great job on the presentation. And, you know, fair housing is definitely impacting us in Wayne County, where my organization serves to do housing development and has a continuum of solutions for the homeless. We see disparate impacts on, redlining still occurs, by the way,
Right.
in different ways. So if you're buying a home, and there's certain communities where if they know that you are, it's Pride Month, so I'm gonna say if you are LGBTQ plus and they don't want that in their community, there's ways that they are still trying to prohibit those populations, from buying a home. Same as people of color. The disinvestment is still occurring in blighted areas in metropolitan Detroit. So it's not as overt. It was a covert process then, but it was exposed. And now there's more subversive measures that are still occurring in housing today. We're seeing even in Detroit, with the increase in basic rental units, the housing prices that are just pushing people of lower socioeconomic statuses from being able to participate in the resurgence of homeownership in metropolitan Detroit. And you combine that with, the homeless situation. Right. And the lack of access to adequate housing for the homeless population that disproportionately affects people of color, then you see that there's still today in 2024 issues with fair housing.
Right. It's crazy.
Thank you. Thank you. I appreciate you all having me here with this esteemed panel. And I work with Frontline Communities and with EcoWorks. We're a Detroit-based nonprofit working in environmental justice with climate planning and sustainability. Communities of color, Black, Indigenous, people of color, impacted disproportionately by climate change. A lot of that has to do with energy burden and energy insecurity. Most of the communities that frontline marginalized communities are in areas that have been deemed as undesirable, as Nina pointed out in that map. We've done a lot of studies with the University of Michigan and Wayne State with climate vulnerability maps. And you can put those maps over the maps that Nina has shown in any city in the state. And it will show that areas where people of color live are the ones most disproportionately impacted by climate change. A lot of the infrastructure that was put into communities that are deemed desirable were not committed to communities that were deemed undesirable. So you have communities that are affected now by floodplains. You have communities that are affected by heat island indexes. You have communities that are impacted by air quality. And most of those communities are communities of people of color. So the zip code 48217, which is in southwest Detroit, is the highest asthmatic rates in the state. Fifth highest, third highest in the country. What's there? Industrial, Marathon Petroleum Plant, other several plants, the bridge. You go there and immediately, if you take an environmental justice tour, the fog hits you right when you cross over, right? It's just the smell. People are having to live in these conditions. The cancer rates in those areas are high. They can't move. So when the bridge was saying they wanted to buy the properties, the values that they were offering people 2 blocks within that zip code versus other areas, the discrepancy in how much your home was worth was just not fair at all. It wasn't equitable. So now you're telling someone your home is only worth a very marginal amount, and this is where you've lived your whole life. We're saying we'll pay you to move, but we aren't going to give you enough for you to move to a community that you can have a better quality of life, a safe home, access to good public school institutions, and health care. And so things are set up systematically for people of color to not be in equitable situations. And so that's something that we need to address. Also, for example, in floodplains, right now, toxic mold, we're working with people that were flooded out 16 months ago on the east side of Detroit. Black mold is not something you just clean up with bleach.
Right.
But because those homes are in floodplains, you have people dying, you have people moving into their cars because they can't live into their houses, they can't afford to go to a respite home or a temporary shelter. The infrastructure in these places is so deplorable that you now are facing just very high environmental harms and impacts to these communities. So that's some of the major discrepancies that the environment places on homes that are in undesirable locations.
Thank you.
And can I just add to that the issues with the environmental injustice in certain communities doesn't just end with the environment and their housing prices and the rental unit. It lends to the other areas that impact their health, like access to food, healthy food, access to quality education, which she mentioned. And those folks who are homeless have a life expectancy that's 12 years less. If you've been homeless for a year or more, you will live 12 less years than the average person. So these are issues that really are impacting everyday lives. And as you think about where we're sitting today in Wayne County, there are 83 counties in the state of Michigan. This is number 83 as it relates to health rankings for our state. So think about where you live and communities even around this area. If some of you have come in and you're not from this area, some of the residents have to drive 10 miles to get groceries. And if you don't have a car, they're shopping at the neighborhood liquor store. that is not fair housing. So fair housing is not just about a safe place to live. It is about access to the necessary fundamental resources that you need to live a healthy quality of life.
And to add to that, thank you, Linda. When we talk about making decisions, so in these areas that you have high energy burden is the percentage of your income that you spend on your utilities. Oftentimes in these communities that don't have the infrastructure, the homes are dated. So 50% of homes in the Detroit area, Wayne Metro, were built before 1950. 80% were built before 1960. So you've got such an aging housing infrastructure that utility rates are out the roof. We don't have the infrastructure in those homes so that you can have lower utility bills because the roof may not be good, there's not insulation, the windows may not be good, you've got foundational issues, all kinds of issues. So now you have a family that in Detroit, the energy burden, people are spending 10% of their income on utility bills. Nationally, the median is 3%. So now if I'm spending on a low income as it is, 10% of my cost, I'm having to figure out, do I buy food? Can I pay for my medicine? Or do I pay for my utility bill? And then the issue is I may be shut off, so what do I do? So you're asking people to think about their quality of life in situations where they're unfairly being burdened by where they live.
So I think a lot was covered, and I don't want to be redundant, but I think one key thing that I'd like to add to the conversation is just the emphasis on chronic conditions. You know, as we think about populations that have a higher prevalence of chronic conditions, and we think about the overlaying of the maps, as Brianna's mentioned, you know, what I think back to is COVID. You know, the same map that they showed during COVID is the same map that we show when we talk about environmental justice, the same map that when we talk about water quality, when we talk about housing disparities, it's the same communities. So what I think, again, and what I'm very fortunate that we've been able to do here in Michigan is think more comprehensively. There isn't one thing that we need to address, there's many. And so it's about how we braid these solutions together.
No, that's a great point. And as you all were discussing this, I kept thinking about like the school districts and having like our children go to specific schools that don't have enough funding, or even like the zip codes determining how much your car insurance is going to be maybe costing more in areas where you're already struggling to clean up the black mold and to do all of the other things if you can, right? So that's really interesting. So this brings me to the next question, was how can we prioritize equity and inclusion in urban planning and development processes to prevent further marginalization of vulnerable communities?
Looking at me again. Well, I think what we're doing today is the first step. And this isn't, you know, this conversation, having the conversations, you know, doing the research, illuminating this issue, right, just like we did during the pandemic, right? If we didn't know about the disparate communities that didn't have access to testing, didn't have access to vaccines, didn't have access to care, then we couldn't have put solutions in place to help address that. And I'm very proud that the state of Michigan took the necessary actions to do that, and I was happy to be a part of the solution through my organization. But having this conversation at grassroots level all the way up to the legislative offices and the governor offices, so that policy decisions can be made with informed decision-making, right, tools and processes, rather than a group of people sitting in a room like this and deciding for the masses without the necessary information and data to inform those decisions. And then the appropriate monitoring to make sure that those policies and measures are being enforced. Oftentimes we put policy in place and we don't monitor it and give people a voice so that if it's not occurring in the way it was designed to occur, that people can report it, people can say something so that it can be addressed.
Nice.
I'd love to add to that. I think it's so important, like you mentioned, Linda, to make sure that you have the impacted community at the table. I think so many times we have people who, you know, they use data, they have all of this perspective of what they feel like the solution is, and they're not even close. And so it's so important to make sure that you're intentional in planning and you're not really going out there trying to check a box. Like, you know how sometimes you have a solution and you're like, hey, how does this sound? And you do it anyways. Really being intentional about engaging. And that's what we've tried to do in our work, ensuring that as we think about social determinants of health, what does that look like? Who's impacted? How can we make sure that they're involved? And some of the barriers with that is just time. You know, if you're working and you have a session during the time that people are working, do you think they're going to be able to participate? If they're not being paid to be there as if an organization is being paid to be there, like I'm paid to be at a table. If this is something that someone is advocating for and they're not being paid, they should be. And so we've made sure that there's a compensation policy for that. What I think about personally is when I was the Clean Water Public Advocate and thinking about, again, my connection to that. Like my grandparents still live in the city of Flint. And thinking about the water crisis there, as I'm sitting at the table and I'm hearing people say, oh, we should do this and we should do that. And then I go visit my grandparents who are trying to figure out how to put a filter on their shower and thinking about how many filters they get that month. Again, it's a disconnect between what policymakers and what people who are sitting at the table think is the solution and what people really need. So I think that's so important. And then I'd like for us to move further upstream with health in all policies. Every decision that's made, as you talked about community development, should think about the health impact because we created these conditions. And because of that, people in the community have health impacts. So incorporating that in, whether it takes more time to develop a housing development, or it takes more time to get you a grocery store right there, the planning to make sure that, again, we're building communities that are supportive to health and overall life expectancy.
Excellent. And to add on to that, the education is the key. One thing that we try to do is that we make sure that we need to demystify these conversations. We need to just demystify about climate, about environmental justice. Have the community define what equity is. We need to have what is behind that word. If you use that word, mean what you say. Don't just say we're going to be equitable. What is equity? What is equity? If I'm in a situation and I'm facing extreme conditions, I have lead in my home, I have asbestos in my home, I don't have running water, or I'm facing energy insecurity, or I'm dealing with outages every time it rains, and I'm losing money by food and medicine. Let's talk about real issues that are impacting me, but a part of that begins by the education. If communities don't know what policies impact them, what health impacts are impacting them. For example, with the air quality and the cancer rates, a lot of people didn't realize why they had cancer, why they have asthma. It's not necessarily genetic all the time.
Right.
Environmental factors, as Nina said, are impacting our health, are impacting our lives. We need to give people the resources and the information in ways that they can understand. We need to make sure that we're calling you in, not calling you out. We're making sure that we start the planning at the ground so that everyone is involved in the decision, that you have a voice, and that we provide the resources for you to be at the table. Oftentimes it's intimidating. I know we work a lot with the Regulatory and Michigan Public Service Commission. Well, if you aren't there and you don't know the acronyms and some of the nuances, you feel like you're being overlooked. But you really are the most important person in the room, right? Because these policies impact those of us that are in the community. So we want to make sure that we're empowering you, that we're providing resources and education that meet you where you are in different forms of media, language barriers, disability, literacy issues, to make sure that people feel that they can be part of the solution and that we have strength in numbers.
And that's so powerful. Representation matters.
Right.
So you can't wait for somebody else to fix it. You are empowered. You are the most important person in the room. We are the most important person in the room because we're taxpayers, because we take up space, because we're worthy. And, get involved, be a part of the legislature, run for office, become an activist, take part in the process because you represent an area or a constituency that may not be at the table. So if we don't take risks to get involved, to serve on nonprofits, to work for the state, to advocate, to join a support group or an activist group to help address an issue or concern that's in your community that you see, I always say to my team, if you see something, say something. So if you see an issue, you see a problem, get involved in the solution. Your voice matters. People need to hear from you. I tell you, we talk to legislatures, and Nina's at the State Department, so she knows, but they are not walking your communities. They're not walking in neighborhoods. They don't see what we see
Right.
and experience every day. So without input from the stakeholders, it's difficult to make decisions that represent what is needed by those communities.
That's very powerful, and I think what I've taken from that is that we in our own communities need to basically reclaim not only our narrative but our space, right? And be vocal about that. And first and foremost, that you brought up from the beginning, and then you both have reiterated, is we need to do our homework. Right? It's not just about waiting for somebody to come save us, but we need to be able to provide facts as well as why we need to be saved. Is that accurate? Like, do we need to be telling people we need to be saved when it's very apparent?
Can I reframe that? I don't think anyone needs to be saved. I think we need to go back and fix the issues that were created by people who weren't us.
Absolutely. 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 So having said that, let's talk about policies and recommendations, right? So I know that in preparing for this, you ladies have put together some policies that I think are really important. And I thought maybe I would give you guys the opportunity to discuss what policies you believe needs to be implemented or strengthened in order for us to move forward. And I can leave it to any one of you guys.
So I can go on and on. I say the Safe Drinking Water Act needs to have more of a health-based approach as opposed to a regulator approach. Having an arbitrary number of, if it's above this threshold, then we do this action. That's not a health indicator. Any consistent source of lead coming in your water needs to be eliminated, especially as you think about children who are consuming this for a long amount of time. So over the course of their life, think about the impact. So that's one thing. I think we can talk about a number of things, but I think collectively, we need to make sure that we have health involved in all of our work. You know, I feel like, again, everything is so siloed, and I've had really the privilege of working in different spaces. Like, I've worked in energy assistance, I've worked in water, I've worked in maternal infant health. And the key takeaway from a lot of this is, like, our work is siloed. We have all of these experts who really dig into their niche area, but it's all intersected. Maternal infant health outcomes are the way that they are, and there's a huge disparity where women of color, especially Black women, are dying, and it's because of all of these other things that compound that. There's racism, there's, again, the communities and how they're built, there's things within how physicians and providers are trained. There's a number of things that contribute to it, so you need a comprehensive solution, and one is just acknowledging that we have racism in our policies, and that should be the focus. I just wanted to kind of call that out before we talk about solutions, because I think, again, we can go line by line about the number of things and the number of changes that need to be made. But I think, again, comprehensive solutions, and I'll talk a little bit about the hubs, but I want to make sure that Brianna and Linda have space to add their contributions as well.
I don't know about you all, but I could say that, you know, it's so refreshing to hear somebody at the State Department of Health and Human Services say that we have racism embedded in our policies. So thank you, Nina.
Thank you.
Because it starts there, you know, recognizing the problem. And so some things that we're doing, you know, and I have to give credit to Nina and her team, is they're really working hard to address social determinants of health, which includes all of the things that we talked about, and placing hubs in very disparate communities to help address their individual and unique needs for that area. And one of the things that we are working to help incorporate into that is housing solutions. The people who are homeless have, I told you, the life expectancy that's cut by 12 years, but they're also 5 times more likely to die from chronic medical conditions. They are hospitalized, you know, in the ER 3 times more than the average person, and their healthcare costs are through the roof. I mean, it's exponentially higher than the average person. That is inhumane. It is inhumane. So incorporated into the hubs, we're advocating that there are solutions to address medical respite for people who are unhoused so that they can recover from their medical conditions, get the adequate care and support that they need, as well as get the housing that they need and deserve, that they, evaluate what they're eligible for, help them with employment opportunities, reunify them with family members. It's an opportunity to address their health needs as well as their housing and well-being issues as well.
And as a part of that, the beauty of us coming together is that we'll continue with trying to find solutions, is that we were trying to develop ecosystems and an eco-district to develop ecosystems. And so with the homelessness and then the social determinant health hubs is that building sustainable communities, building communities where the communities are prioritizing. So where there are infrastructure issues, where there are air quality issues, where there are heat island mapping issues, where there are flooding issues, have those priorities be identified by the community so we can then bring in the resources to help that community put together climate plans, energy plans, helping to decrease the energy burden. Energy is a basic human right. It should not be something that certain people get and certain people don't. You should have access to affordable, clean water. You should have access to affordable utilities so that you can live in a health and safe home. And a lot of the programs that we need policies and funding for, we need to start there with a health and safe home. You can't do any energy efficiency upgrades without having first a health and safety home. Then you can look at some weatherization. And weatherization looks at things such as the insulation and what other needs are met to make a home become energy efficient. But there is not enough funding for those programs. And so the amount of people that are living in deplorable conditions, to be honest. We're amazed sometimes by the programs and the funding. They'll say, oh, we'll give you $10,000 per house, and whatever organization, feels like they're really doing a lot. But it really is a pass-through. This person's roof is falling apart. A roof alone takes more than $10,000. And we haven't even gotten into the interior of the home. A lot of these homes don't have one working bathroom. And this is the 21st century. So there's so much need that needs to happen just to provide, again, a health and safety home, that we need policies that are focused on that, and then when we build out.
Can I talk a little bit more about the hubs now? So an SDOH hub, just to kind of give some clarity on that, is a collection of partners. And so we have 16 hubs across the state. And what that does is allow us to bring together those healthcare, social care, and other partners that really help align their efforts. So as you're thinking about investment, for example, in your water infrastructure, they're at the table and also partnering as we're thinking about the social and other healthcare, benefits that you want to provide to community residents. So again, it provides that ecosystem that Brianna's talking about, where we're not looking after the fact to bring that partner in. As we're planning, as we're getting investments, whether they're federal, state, local, or whomever, we're thinking about how we can use that funding to make sure at the end of the day, the people in your community get what they need. Another thing that's important about the hubs is that they're self-led. This isn't the state coming in and saying, this is what we want each hub to do. This is really, again, we're providing funding so that you go out in community, you determine what you're prioritizing, and then from there you invest in it. We have hubs that are investing in transportation, hubs that are investing in food. But again, what we want to do is make sure that they have the infrastructure and capacity, because unfortunately, due to a lot of these systemic inequities that are built in our system, we've torn apart the capacity of communities. So we're providing resources so that they can convene and really have an opportunity to build out and prioritize goals and really make sure that they have comprehensive solutions.
Thanks. And part of the hubs probably would to ensure transparency, right?
Yes, because that's a major barrier. As we talk about how money's spent, what we're actually doing, that's a major thing. And so with the hubs, we're having transparency in how the funding's being used. We have data points to measure, okay, if we've invested, for example, $1 million in food, what specifically is the impact of that? How are we measuring impact so that we don't have someone giving $1 million to their buddy, because they have this deal going on with a grocery store. Really, we want to make sure that it reflects the values and the needs of the community. And so in the next year, we'll be releasing dashboards so that communities have an opportunity to see how the money's being invested, seeing how things are being impacted, and have more, again, of a say-so in how the work progresses.
Right, and then one of the other things that you guys had put together in this policy is ways to support expansion of housing for low, moderate income homes, right? And some of them would be to tax certain purchases, am I correct?
Well, there's states that have models where they tax certain dispensables or cannabis or gas tax to help support essential needs for that community or that state, like a housing tax, for instance, on cannabis, since
Right.
it's now legal.
Yeah, if you want to be happy, make everybody
Right.
happy, right?
There's a tobacco tax, there's a gas tax. So those are ways that we can help ensure
I
that
love
there's
it.
funding to support the infrastructure changes and redevelopment that's necessary without disrupting other services.
I love it. That's a great idea. What about policies that support reducing residential energy burden?
So those are around coming up with things like percentage of income payment plans. They've done that a lot on the East Coast. Massachusetts is a model, but looking at what really is a fair, equitable way to charge people for your utilities. If you're making below the average median income, you shouldn't be paying what somebody else is paying that is at a higher wage level. Also, there's a cycle of poverty that is embedded in our systems, and as Nina pointed out, racism. Oftentimes, utilities have predatory practices, and so they pull you in that we are saving you by this program, and you think you're okay, and the minute that you feel like you're treading water and your head's a little bit above the water, they pull out that assistance program and said, okay, now you start paying your energy bill. Well, what happened? I still am in the same income category. I still have a lot of the other issues that I have that I'm getting social services from. I'm not ready to be put back at a higher level to pay. I can't pay, so then I go back in arrears. I go back into then defaulting on my payment. My utilities get shut off. I then become disqualified for other services that I'm getting. So it's just this cycle of poverty. It's not again, we don't need to be saved. We need a solution that allows me as a homeowner, as a person, as a renter, to be in control of being able to learn how to manage my utility consumption, putting in smart meters, being able to have ways that we track, and again, percentage of income payment policies, so that I can have some sense of pride. People don't want to be in despair. People want to take care of their families. People have pride.
Right.
But because of the downtroddenness and the cycle of poverty that's given, and they don't have an opportunity to get out, it's just a never-ending cycle. So let's put together programs that empower people, give people a sense of ownership, give people an opportunity to feel that I'm being responsible, I have something I can manage, and I have an opportunity to then balance that to do other things for my family, to pay for food, to get fresh fruits and vegetables, to be able to put my child in a school where they can learn equally, to have long-term opportunities, to be able to afford a home that will increase in value so that I can build generational wealth. So there are ways that we need to make sure that we are putting programs in place that don't create dependency, but allow for resiliency, what I need to survive, and allow for opportunities for me to be able to survive and thrive.
Can I add to that too? Like, I definitely agree, Brianna. Like, that approach of moving away from crisis. Like, why does a person have to miss a payment? Why do you have to wait until a person is in crisis in order to support them? That creates that system of like the person being dependent on that resource. And that's why I'm grateful to be on the Low Income Energy Assistance Policy Board with Brianna, as we're thinking about how MPSC can really help move that work along. How are they working with providers and community groups? And as we think about policy, to move beyond crisis and thinking about how we reinvest in communities, because we wouldn't need energy assistance programs if energy was affordable.
Right.
So again, it's just moving more upstream.
Yeah, I think, you know what, let's move to some questions in the audience. I think that's a great idea. We have about 5 minutes.
Just a very fast question. So I think energy affordability payment programs are very nice, but I mean, like, what about a publicly owned utility? Like, because to your exact point, like, we can shift around who pays whatever, but when you have a privately owned utility company, it's beholden to its its investors versus the people it's actually serving. There's always going to be a new reason to raise rates. I mean, you see it over and over and over. So, I mean, like, so I just, what are your thoughts about, to me, a bigger change here than just a low income payment plan?
So the city of Ann Arbor has been very progressive in advocating for publicly. So there are models out there that people are trying to do that. Missy Stoltz, the director of sustainability for the city of Ann Arbor, has been pushing for that for years. You've got several nonprofit organizations in the city, Solidarity, We Want Green Too, EcoWorks. A lot of us have been. DTE is a barrier, so that would be great, but because of the monopoly that they have, that probably isn't a short-term answer, but a practical solution that would be to create fairness in the system. And that's why we're trying to push then for community solar, for other ways to get around using renewables, not having to be dependent on fossil fuels, so that the utility then, we aren't so beholden to the utility.
Are there any other questions? Yes.
So going back to an earlier topic, and I completely agree with what you said, that old policies that are still in place are very systematically racist in play. How do you broach that with people? Because the second you say something's racist, people shut down, they get defensive. So how are you able to go around and go, hey, we can show these maps that these old redlining districts environmentally, functionally are falling apart, but the second you add the word racism to it, the old guard just kind of shuts everything down. They're like, no, those policies aren't in place anymore, but they are still on the books.
Right. And so, as you mentioned, people shut down whenever you bring up racism, even though that's the reason for the majority of it. What I would say is a lot of my space in policy is thinking about how we reword that in a way that doesn't create a divide. And so with all of our work, we're thinking about how do we position this policy so that it gets approved, because again, we don't have the final authority to do that, but it resolves the issue that it created. I don't think we'll get to a place where we can be as blatant and say that, even though we have a governor who has been very open about COVID and the racial disparity there and how these things are deep rooted. But again, I think we have to be strategic in thinking about how do we unravel these systems in a way that, again, doesn't create more unfortunate chaos because now people have shut down. But that's a very valid point. And again, that's why people avoid using that, but it is what it is.
And I would add that it's in our country, we have a history of racism. In other countries, it's a caste system, and it's the same concept. And so what you do is you use data. That's why arming yourself with information and data helps you to have that conversation in an intelligent way rather than an emotional way. And it helps people to understand the issue, not the things that divide us, as Nina said. So first, arming yourself with information, objective data, and have the conversation from the perspective of the issue, not the emotion. Racism, the term itself, evokes emotion. And so just talking about the issue of equity for everyone and showing the disparate differences in the data is the best approach to the conversation.
I think we can talk about this topic
Forever.
all day, forever. But we are running out of time. So I just wanted to take this moment to thank our distinguished guests on the panel, Nina Saucy, Brianna DeBose, and Linda Little. Your time and your information is so valuable to us, so we really appreciate it. And I wanted to thank all of you guys for coming up and showing up and really focusing in on what our distinguished guests had to share with us today. We have a note taker here from Michigan Department of Civil Rights who is going to be putting together the policies that we discussed today and some of the answers to the questions that were posed to our panelists. So that will be made available to everyone online. And we have about 15 minutes that if you want to go and maybe freshen up before lunch gets started at noon. But I did want to give a round of applause to our panelists. Thank you so much for your time. I learned so much today, so I really appreciate it. And thank you again. Thank you. And I hope that you guys find the rest of the day very informative. Thank you so much. Thanks.